Vi mennesker lever ikke av å utvikle nye områder til hus, hytter og fabrikker. Vi lever heller ikke av olje, aksjer, vannkraft, teknologi, skattepenger eller gigantiske broer. Vi lever av mat og vann som kommer fra naturen. Mat og vann i næring og byggesteiner som kroppen trenger for å vokse og fungere, og for å holde seg frisk. Alt for mange har glemt å tenke på hvor maten og vannet og medisinene vi trenger kommer fra. Dersom du var i tvil, alt vi trenger kommer fra naturen. Ingen natur, ingen mennesker. Så hva trenger naturen for å overleve og fungere? Naturen trenger urørte sammenhengende områder der den kan vokse og formere seg. Naturen trenger rent vann, insekter, byttedyr, rovdyr, planter, nedbrytere, sopp og mikroorganismer. Kort sagt, naturen trenger mangfold og balanse. Og hva skjer med oss mennesker? Nå som naturen er under konstant press fra menneskelige påvirkninger, nå som klimaet løper løpsk, nå som mikroorganismer blir resistente mot medisiner, nå som fangst og handel med truede arter fører til at sykdommer spres fra dyr til mennesker. Hva skjer når naturen ødelegges? Samtidig som vi vet at hver art som utryddes, har vi mistet noe for alltid, og kanskje også en kilde til medisiner eller mikroorganismer som kan redde oss mennesker. Dette er store og viktige spørsmål som jeg gleder meg til å lære mer om i dag. Velkommen til konferansen En verden, en helse. Jeg heter Gaute Velle, jeg er professor i biologi, og jeg er også leder av faggruppen for fremmede organismer og handel med truede arter i Vitenskapskomiteen for mat og miljø. Jeg har tenkt å lose dere gjennom dagen her i dag. Så den konferansen her, den arrangeres av Vitenskapskomiteen for mat og miljø, Miljødirektoratet og Mattilsynet. Og jeg synes vi har laget et utrolig spennende program til dere. Og så er vi heldige som har fått med oss en rekke helter som foredragsholdere. Og foredragsholderne, de er helter fordi de jobber hardt for å prøve å svare på disse store spørsmålene som jeg akkurat stilte på vegne av oss alle. Når vi forventer at samfunnet skal ta vare på naturen rundt oss og oss, ja, da er det disse personene som gjør jobben. Før vi går videre, så har jeg litt lyst til å utfordre dere som hører på. Vet dere hva en kunnskapssyntese er? Kanskje, kanskje ikke. Men det er altså noe vi gjør når vi oppsummerer forskningsbasert kunnskap. Så hver forskningsartikkel presenterer bare en liten del av en sannhet, en del av et større puslespill. Så i en kunnskapssyntese så prøver vi å sette sammen alle brikkene og se en helhet. For eksempel lage en artikkel som oppsummerer kunnskapen fra 1000 andre artikler. Og det er egentlig dette dagens konferanse handler om. Å se sammenhenger på tvers av rådende kunnskap og oppsummere kunnskap. Og så har noen av dere kanskje hørt om Richard Feynman. Han var Nobelprisvinner i fysikk i 1965 var det vel. Og rett før det så mente kollegaene hans i California, han jobbet ved Norwegian Institute of Technology, at fysikkundervisningen, den var særdeles kjedelig. Det eneste de fokuserte på, det var gamle, kjedelige teorier, og de lot være å ta med alt som var nytt og spennende. Men da kommer Feynman inn i bildet, for han var i ferd med å bli en stjerne på alt som var nytt og spennende. Og så spurte de han om han kunne oppdatere grunnemnet i fysikk. Og det ville han, men han ville gjøre det kun en gang, og kun på sine premisser. Han startet undervisningen med å stille et tilsynelatende enkelt spørsmål. Dersom en katastrofe inntreffer, og all kunnskap blir ødelagt, og kun en setning blir ført videre til hva nå enn det er som overtar jordkloden etter oss mennesker, hvilken setning vil du da ha skrevet som inneholder mest informasjon i færrest mulige ord? Dette er egentlig den ultimate kunnskapssyntesen, altså å redusere all informasjon inn i et fagfelt ned til en setning. Og Feynman selv var fysiker, og svaret hans, som han da bygget egentlig fysikkundervisningen sin rundt, det var All things are made of atoms, little particles that move around in perpetual motion, attracting each other when they are at little distance apart, but repelling upon upon being squeezed into one another. Så min utfordring til dere som tilhører, det at dere ser for dere at all kunnskap blir ødelagt, og at du kan etterlate deg en liten papirsimmel med informasjon. Og den skatten, den skal du legge i en metallboks og grave trygt ned for fremtiden. Og så går årene. Deretter, etter at alt støv har lagt seg og verden igjen levelig, så blir denne skatten som du har nedtegnet funnet av noe, eller noen, hvem vet, og skal da være til hjelp for å bygge opp et nytt samfunn. Så det jeg lurer på, det hva du ville ha skrevet. Og når jeg snakker om kunnskapssyntese, så snakker jeg egentlig om vitenskapelig informasjon, men på din papirlapp så trenger det ikke være vitenskapelig informasjon. Det kan være hva som helst, for eksempel kanskje at nyfødte mennesker født uten fordommer, eller kanskje at ja, foreldrene dine har rett. Kaldt trekk mot halsen det farligste som finnes. Jeg ønsker meg også at du skriver din setning i spørsmålsboksen som du finner nederst på siden på dette webinaret. Merk innlegget med katastrofe, så skal jeg prøve å lese opp noen underveis i løpet av dagen. Jeg biolog og opptatt av at mennesker burde leve mer i pakt med naturen. Og jeg selvfølgelig også opptatt av trygghet for barna mine og på min mor på 74 som har hatt organtransplantasjon. Så det jeg vil ha skrevet i min setning, det helsen til jordkloden. Og helsen til alle skapninger som lever her knyttet sammen. Og siden ressursene på jordkloden begrenset, vil et forbruk utover det jorden produserer i samme tidsrom skade alle. Nå skal vi over til dagens foredragsholdere. Og igjen, dere som tilhører, dere kan skrive spørsmål i spørsmålsboksen som ligger rett under streamingvinduet. Og litt til høyre for det, så kan dere også si at det mulig å sende tilbakemelding på denne konferansen, så gjør gjerne det i dagen også. So now, I would like to introduce our first speaker, Dr. Caradee Wright. Caradee is a specialist scientist at the South African Medical Research Council, which is leading the Climate and Health Research Program. She is an expert in environmental factors that can potentially affect human health. And Caradee Wright will give the opening talk today. So please, Caradee, the screen is yours.
Thank you very much. Thanks for the introduction. I'll just wait for my slides to appear. There we go. Thank you. A sustained Earth hinges on a symbiotic relationship between the environment, animals, and humans. We are one. However, in the recent past, the balance between us three has not been optimal. Many things that we do advance human health and well-being, but also increase our vulnerability to global health challenges. COVID-19 and antimicrobial resistance are current examples, while climate change, poverty, conflict, and migration prevail. Not only is human health and well-being threatened, domestic animals and wildlife face similar threats. The concept of One Health highlights the synergistic benefits of closer collaboration, coordination, and communication for all who share our planet. Shared environment, shared medicines and interventions, and safe food and food security. Much of this has been thoroughly discussed in the UNEP Frontiers report. Next slide, please. In the UNEP Frontiers report entitled Preventing the Next Pandemic, released last year, these two images illustrate the relationship between animals, humans, and disease, and how we face similar threats, and the need for the 3 C's that I mentioned: collaborating, communicating, and coordinating. It is how we need to work together in a way that we can find the sharing of the environment, the medicines and interventions, and the food that I spoke about. And the image on the right-hand side of the screen comes directly out of the UNEP Frontiers Next Pandemic report, which brings all of us together in the concept of One Health. The story that I would like to share with you today is from my very first One Health project more than 10 years ago. The news was abuzz with the tragic stories of mass crocodile deaths in the Kruger National Park in South Africa, a very famous conservation area, as well in Massanger Dam in Mozambique. Crocodiles were drowning as their body fat hardened because of a disease called pancreatitis. Investigations showed that industrial contamination of waterways by heavy metals was being taken up by fish, and then the fish were being consumed by the crocs. Pollution was entering the river catchment. Next slide, please. This is an illustration of that catchment, a highly diverse network, almost like veins, of tributaries and the main Olifants River. And the pollution was entering this catchment in a highly industrialized area known as the Highveld on the plateau of South Africa, and was affecting water quality in both South Africa and Mozambique. Many communities live in both countries alongside this river, and so the question arose, are the communities affected by the contaminated water? If so, how? And what can be done to protect both wildlife, animals, and humans? Next slide, please. The Lower Olifants Community Health Project brought about a diverse range of individuals, including conservationists, veterinarians, public health specialists, social anthropologists, and others, to try and unpack the risks to health of people, and in this instance, fish and crocodiles, to find answers and opportunities. People relied on water and fish for their livelihoods. The top right-hand image here is a dissection from a fish that was found in the river, illustrating the same pancreatitis effect that was in the crocodiles. The fish were contaminated. The water was polluted from the industries, but also from the communities with litter and human waste. The rivers and the dam were core elements of the community's existence. Next slide, please. Focus group discussions revealed challenges that people faced when it came to water. For example, having to collect water because there was no reliable provision of the water to the households in which the communities lived. Because the water was sporadically available, it had to be stored. And often the stored water was self-contaminated by the individuals because they were drinking from the scoop that they used to decant the water. But they also saw water as life-saving and healing, and it had special meaning in their lives. A critical pathway of contaminated water was ingestion of river-fed crops that were located alongside the river. Even though, as we understood from working with social anthropologists, borehole and spring water were less trusted than the river and dam water, we advocated for its use until the polluters were apprehended and we could ensure that the water that was being used by the communities was safe. We embodied all that the community taught us about water in a local game played with rocks. Next slide, please. And adapted to encourage One Health. The game was shared widely, and one community even developed an anti-pollution committee to monitor water quality, to share the game, particularly in schools. This game was in fact something already played in Mozambique, so it was not unfamiliar to people, but we just tried to put in the elements of One Health that we were trying to encourage people to understand, but using their own community understanding of water and the river. Next slide, please. The project helped communities, researchers, and government officials to share knowledge and seek solutions for healthy people, healthy animals, and healthy environments. It reminded us that we are one. Last slide, please. In celebration of today's event, I wrote a poem which I'd like to share with you today. We are one with the land, sea and sky, with the birds on the wing flying by. We are one with the coral, moss and soil, with the snake fast asleep in a coil. We are one with the trees, farms and caves, with ocean animals gliding through the waves. We are one with each other, with all creatures, big or small, with those we have seen and others not at all. For generations past and present, hold the torch, don't drop the ball. For Earth as our steward, we are one. Let's stand tall. Thank you.
Well, thank you for an excellent talk and a beautiful poem. I wonder if you have experience from a part of the world that well, obviously we do not. Do you think there is a turn in the public view on the One Health issue in the Western world in the wake of the corona disease?
I think that the current pandemic has certainly opened our eyes to how just interconnected we are, not only among ourselves as humans, and how travel and the means of communication have been shrunk over time, but also with how precarious we live in terms of our relationship to the environment, both in terms of fauna and flora. Who would have thought that something that happened continents away from us could spread so quickly? And it was not an act of me. It was an act of others that has really infiltrated every single household, no matter where you live on Earth today. And I think that really means it's raised awareness. In some communities, perhaps rural communities, in deep rural areas, there is not a thorough understanding of how this all works, but certainly an awareness that we are interconnected.
Well, thank you. I really agree with that. And I hope that this awareness will last as well. I think we will move on. Thank you again, Caradee Wright, for your excellent talk. I think we will move on to the next speaker today. And this is Professor Christian Walzer, who will give a keynote lecture. Christian Walzer is the Executive Director of Health at the Wildlife Conservation Society. He's a wildlife veterinarian and professor of conservation medicine. And his focus is to link the health with conservation of animals. And for his work, he has received several research and service awards. So please, the screen is yours.
Thank you very much for the introduction. Just making sure you can see my screen, because I can't see anything. Do you see it is that correct now?
Yes, I think it's fine.
All right. Thank you very much. And thank you very much, Caradee, for the wonderful talk and the even better poem. That's a really great way to start my morning. So good morning, everyone from the Bronx. I hope everyone's staying well and safe and sane. And thanks very, very much for this invitation. So building on what Caradee said, and I'm obviously also building on what my colleagues are going to say following this talk, we're obviously in a world of multiple crises, climate change, biodiversity loss, massive biodiversity loss, anthropogenic change, of course, that's driving this. But I also really want to remind that this is also a time of inequity, racial injustice that has really come at the forefront. So on the background of all this, and the overexploitation of our planet, which I don't need to go into, obviously, in this forum, a virus sort of slipped across the interface between humans, between wildlife and humans at some point in time. And this is not really anything surprising. So zoonotic origin or zoonosis are very, very common. And especially as we domesticated wild animals, we also acquired during this domestication process many of the diseases of these animals. And some of them we made uniquely our own. For example, measles, a disease which is now seen as a human disease, of course, but it's originally a disease of cattle. And these infectious diseases, sort of these emerging infectious diseases that we're seeing and that we're particularly worried about, are dominated by zoonotic origin pathogens. It's estimated that some 3/4 of them originate in wildlife. And some of the examples, of course, the well-known examples like HIV, Ebola, H1N1, SARS, Nipah virus, and so on, are all examples of these zoonotic origin pathogens. And actually, if you look at the most common vaccination for children, measles, mumps, and rubella, all three of those are pathogens which we've acquired from animals at some point in time. And actually, mumps was only recently described as having a wildlife origin, and that's in the past year. So one thing I'd like to put out there right as we begin, I've been faced in these past 12 months a lot of discussions about zoonosis and pathogens and where do they come from. And I really think we need to go back and revisit the word zoonosis, because what we're particularly worried about at the moment are not the classic zoonotic diseases such as rabies. While it is completely unacceptable that 60,000 people still die every year of a disease for which we have vaccination, what we're really worried about are potential pathogens. So these are zoonotic origin pathogens which slip across these interphases, enter humans, and then become pathogens there. So I think we get very hung up on zoonosis at the moment. There's a lot of discussion about zoonosis, but actually we need to move on and rethink about our definitions. One thing that's really sort of fundamental to understand is that the number of spillover events and the occurrence of emerging infectious disease is increasing with time, and it's markedly increased. And I'd like to use one of the examples, I think, which is quite striking, is if you look at the occurrence of Ebola virus disease in the Democratic Republic of Congo. Discovered in 1976 along the Ebola River. There have been 11 outbreaks, but 4 of those outbreaks have occurred since 2018. And if you think about it, just in the past year, so now we're 21, so in 2019, there were 2 ongoing outbreaks at the same time in the DRC. So this is a real massive increase. The other thing to remember, while we're all obviously and rightly so focused on COVID-19, is that there are other ongoing global pandemics of importance. One of those being the peste de petit ruminant, a disease of goat and sheep, which is massively impacting wildlife across Central Asia. Disease that originated in Africa and has moved across all of Central Asia very, very rapidly in the past years. And then African swine fever, a disease which, as its name says, has its origin in Africa, has also moved very quickly into the European Union and has also moved. I think it's also reached Scandinavia, if I remember correctly. We've, I think, at least got close to Sweden, and Carlos can certainly tell you more about that later, but has certainly moved across Central Asia and now is becoming a real threat to some of the more endangered pig species in Southeast Asia. So let us not forget there are plenty of diseases moving across the globe at very rapidly, actually. So let's go back to coronavirus 2. What was pretty clear very quickly was that and actually impressively quickly, we knew that it was the zoonotic origin coronavirus, that it was zoonotic in origin. There's broad consensus for that. We've obviously, I'm calling in from the United States. We've probably had the last year has been pretty tough, I have to say. The politicization of this event certainly undermined a lot of the progress and certainly a lot of the discourse about it. The ancestral host is seen to be in a horseshoe bat. What's really unclear is when the spillover happened, the first spillover, and the mechanism of spillover. But one thing that is interesting is that we still have, and everyone keeps going back to this, we have very, very strong signal in the western part of this famous Wuhan seafood market. And the western part of the market, the environmental samples were positive, and only in that western part, really. However, at the moment it's unclear what that means because the environmental samples are not well defined. But there seems to be a very, very strong signal to the area where the wildlife was kept and the people who had wildlife. So, of course, like everyone, we're waiting for the report from the WHO commission that is on the ground at the moment. They just recently visited the market, and there's some hope, at least, that it will be able to provide some clarity. As I said, the spillover from wildlife is really not a surprise. It's not rocket science. Yeah, this has been around. There's been warnings following SARS in 2002 and 2003. It was very, very clear that something needed to change, especially at this interface of live animal markets. But I'd like to take this opportunity and really take 3 steps back again and say, this is not about bat soups, it's not about civets or pangolins or any virus specifically, but it's really about all the interfaces that for which we are responsible, these interfaces between wild places and humans and their livestock. So basically in the forests, let's say in an intact forest, you'll have naturally occurring thousands and thousands of viruses which are evolving there in wildlife species, being shared potentially between wildlife species. You then put in a road, and you put some infrastructure development in there, and you can see the road. The Ministry of Transportation would love to see this as a road which goes from A to B. They don't worry about what's going on the right and then the left of this road, and that they have now created hundreds of kilometers of interface. But this road obviously allows viruses and pathogens to spill over into humans and their livestock, and then by the transport also move these pathogens very, very quickly across large distances. Obviously, when these roads always will end in some urban center, and let us not forget, urban centers nowadays are huge and vastly interconnected. I always use the example, if I buy a rat at the side of the road in Northern Republic of Congo, within 12 hours, I'm in Kinshasa, Brazzaville, which is 18 million people or 20 million people by now. And the next morning or that evening, I can catch a flight to Paris. So this idea that these places are very, very remote and disconnected just doesn't hold true anymore. And this is definitely one of the big differences between SARS coronavirus 2 and the original SARS in 2002, 2003. It's just because of this sheer interconnectedness of the planet. Now, for viruses to actually slip across these interfaces, it's not that simple. And many factors have to align. There have to be sides on the host side and on the pathogen side and then the environment for this virus to drop through, so to say. And you've all seen, I'm sure, the Swiss cheese kind of approach to viruses spilling over. And thankfully, this doesn't happen that often because because spillover per se is happening constantly. There is constantly pathogens moving back and forth from wildlife to humans, to livestock, back to humans, and so on. But for the virus to acquire the necessary traits to actually enter a cell, replicate, and then infect other humans, that is a very rare event, thankfully. Now, going back to the edges, what we're really worried about are these edges, because along these edges, these sort of edges of destruction, this is where the contact happens. You have increased contact, you will have hunting going on, sustainable hunting. People are going there, indigenous peoples and local communities going out to hunt. So they'll be going in several hundred meters using this new road. You'll be collecting wood. You may be actually having keeping your livestock there. And these are the areas which we really need to keep a close eye on. And we also need to really consider what we're doing when we're creating these interfaces. Now, one thing to also consider is that we're sort of anxiously waiting for a vaccine, or some of us have already got a vaccine. A vaccine is really just a stopgap measure, because it's been estimated that there are some 700,000 viruses of zoonotic potential out there. And so obviously that's a lot. And this is a model. And even if they got it wrong a little bit, it's still a lot of viruses. We're obviously not going to get this solved by creating vaccines. So let me go to one particular interface. Now, forests, mining activities, extractive industries, and similar create these interfaces. But we humans, of course, we're particularly good at being rather, how would I say, not careful in any way. And one of the things that we do, and this in certain parts of the world, is that we create live wildlife animal markets for human consumption. Now, let's just be very clear. These markets are for urban centers. They're industrial scale. They do not meet any nutritional requirements. These are luxury items and sometimes even status symbols. But what you're doing is you're putting live animals, often sourced globally, together. You're stacking them on top of each other. And these animals are obviously able to shed viruses and share these viruses. You're basically creating this sort of, I call this a cauldron of contagion. And I always want to point out, if you as a researcher asked for a permit to do this in your lab, there was no way anywhere that you would get a permit to do this. This is really, really just inherently a dangerous idea. Nowadays, these markets are also now complemented by the famous minks, or as there are many species that are used for fur trade as well. And in China and Southeast Asia, often the raccoon dog, for example, is used for fur. But one thing which we had not realized 12 months ago is when the price for fur drops, for example, or they cannot sell the fur, these animals from the fur production suddenly end up on the food market. So there's a complete interconnection between these two pools. And remember that farms, as you've seen with the mink, even in Europe, they're not closed entities. These are also entities which interact with wild populations. So, and these large farms with thousands of animals provide wonderful evolutionary pools for a virus. Once the virus is in there, these are homogeneous animals from a genetic point of view, from their immune system, and you can very, very quickly develop new traits within these populations. Just a quick thing to point out, coronaviruses are particularly good at recombination. And in order for you to get recombination, you need two viruses which infect a live cell at the same time. So if you're creating conditions by putting live animals which poop on top of each other and you're slaughtering things in the same place, that's a really good way of creating novel viruses through recombination events. Obviously, it's not only the market, it's the entire trade value chain. And some of the work we did in the past year has shown that as you move product, in this case, field rats, from their field site where they're captured into the restaurant kitchen, prevalence to coronaviruses increases. So by the time they reach the kitchen, every second rat was coronavirus positive. So there's an amplification that happens in this trade value chain. And, you know, surprisingly, or not surprising, this is nothing new. If you look at SARS coronaviruses in civets, as they moved along the trade value chain, the antibodies increased, the prevalence of antibodies increased as well. And this was published in 2004. So it's a really good example of how we didn't learn anything. I'm going to use an example. Caradee gave you a really nice example of a One Health project. I'm just going to talk about something about how difficult it actually is sometimes to try to pull everything together. This is out of a USAID massive global program on detecting novel pathogens called PREDICT. And I'm going to look at this one. This is a common epidemiological curve. You see from the left here, reservoir in wildlife. You get possibly amplification there. And then at some time there comes a spillover maybe into livestock and then into humans. So, let us look at this point here in time. If you're trying to actually detect this spillover, you need to, at the same time, be sampling humans, the wildlife, and the livestock. And that, we can write these grants and we can say that we're going to do these things. In reality, when you start trying to connect all the different highly siloed parts of our health providing public health services, veterinary services, agricultural ministries, and so on, it really, really becomes difficult. So we have these highly siloed components which we need to bring together if we ever want to work in a really, truly One Health approach. And so we have these very lovely charts, and now and then we manage to do this, but on a broad scale, this doesn't work at all, or very, very limited. Just want to, also from our own experience, have to admit this is not easy. Now, obviously, COVID-19 is just another symptom of our ailing planet, and I'm going to let Carlos talk a lot more about how that interconnects with the environment. But as has been brought up by Caradee and your question previously, it really also has this potential value to, or provides this opportunity to catalyze stewardship for an intact planet. It really is clear to each and everyone at the moment how interconnected we are. And as I said, the vaccine's a stopgap measure, so we need to make sure that following the vaccine, we don't fall back to, the previous behaviors that we had. So as I said, we have an opportunity. And it's driving this message home is really, really impressive. I live in the Bronx. This is an area where I'm a European, but living here, where you really realize how fragile the social fabric is and the social construct in which you live here. Healthcare is practically non-existent. And I was just looking at the news as I got up this morning, and we're now, not only were COVID-19 patients in the Bronx dying at a 4 times higher rate than those in Manhattan, which is only 5 miles down the road. But as we're rolling out the vaccine here in the United States now, we're seeing exact same inequities again. We're seeing the percentage of white people being vaccinated much, much higher than they should be in the representative in the population. So similar problems on the vaccine side. So we do need to really be clear that we have to solve many, many issues around this pandemic, which the pandemic has really highlighted. I'm going to skip this on costs because I know Carlos will be talking about the costs of the pandemic. So one of the things that has fascinated me is where are the front lines of spillover? So as a wildlife veterinarian, what we love to do, we love to go into the forest, find new viruses. Every time you find a new virus, you publish a new paper. It's great. So once you've worked it out, as I said, there's 700,000 of them out there. So obviously your whole career, you can do that. And obviously spillovers do occur there. But the question is for me, do we spend too much time worrying about those spillovers in the forest, or should we be spending more of our time engaging with those parts of society which are probably responsible and are the main drivers for for the extractive processes. Why is that road there? What are we doing? Why are we getting the cobalt out of that area? And so on. So just to be a bit, and I enjoy this much more, of course, when I'm in the United States than probably for a European audience. But one of the things that really obviously drive it home for me is, we always talk about the Anthropocene. It's a word I really hate. I've become to hate it because it sort of means we all, each and every one of us, are responsible. That seems really unfair. My neighbor across the road is not the same, doesn't hold the same responsibility as Mr. Bezos or the head of Apple or Enron or whatever. So I think we do need to think about that a lot more. And I know there's some good reports coming out that address this. But I think probably 1 year of COVID, it just radicalizes just everyone. I think we do have to be radical and start in the real true sense of the word and to address the root causes of our multiple crises that are ongoing. And one of the things that's going to help us, I think, is that nature and environment has been considered a cheap externality. But as we look at the costs now, and as you will hear in the next talk, the costs have exploded. Just the costs of the COVID pandemic are extraordinary. We're talking about figures which I couldn't even imagine before. And we haven't even talked about climate change, or we've sort of forgotten this past 12 years. So I think there's a lot of potential there. So Caradee's already brought this up, so I'm going to be quite fast about this. Obviously, we're going to need, as we address this, we really need to break down many, many silos as we address health issues. We need to talk about, we need to operationalize One Health. And I'm just going to take one example here of what I see as problematic. This is a classic example of how One Health is described. There's many of these out there. It's basically always three circles. Now that really is not helpful. The environment off to the side, a little bit of animal, a bit of human, and then it intersects somewhere. Obviously, that is not going to help us break down silos. That has inherently got three silos. So let me move forward and then make a suggestion. What we really need to do, building on this famous cake of the SDGs, we really need to move towards a sort of a One Health across all administrations and in all policies. If we can't achieve that and tie it into the SDGs, I think we're going to fail again. So the next year is going to be key as we rethink. Everyone's speaking about One Health at the moment, but we really need to spend the next 12 months or more thinking about how we're going to be able to operationalize One Health. And this is one suggestion, would be tying it into the SDGs across all SDGs. And that way we'll have it in all policies. So I'm just going to jump across this. So just to finish off, please visit our webpage. There's a lot of resources that we've put there on various stakeholder interactions, on policies, on that we suggest to help prevent the next pandemic. And thank you very much for this opportunity. Thank you.
I thank you for a so nice talk and loads of very useful information. And I really like your idea of tying One Health to the cake of the SDGs. How can we make this happen?
Well, to make the little graphic took me 30 seconds after weeks and weeks of thinking about it. So that's one thing. Honestly, I've just started. The problem is all of us on this call, I'm sure, we're all reactive at the moment. There's so much going on, we just can't keep up anymore. We're always reactive. I think what we need to do is fight for a little bit of space so we can actually reflect and sit down and think about how do we actually get these operationalizing it. And we need to, and I'm flogging myself here. We need to step back. Instead of writing another paper about operationalizing One Health, and just pushing it out there. We need to sit down with stakeholders and administrations and really think it through. How can we do it? I have seen in some of the places where we've been for 20 years, nearly like Vietnam, where we've worked closely with the various silos of agricultural, human health, public health, and so on. There, you can really set up true One Health collaborations, and that has been very beneficial for them. And during this pandemic, they were able to react very quickly and were very, very coordinated. But as I said, that's a 20-year investment, nearly. That happened there. So not a good answer. Sorry about that.
Well, if it was easy, it wouldn't be a problem, right? But I also have another question, because, this phrase that supposedly came from Donald Rumsfeld. It wasn't him who said it in the first place. What he talks about, the known knowns and the known unknowns and the unknown unknowns. So when it comes to zoonosis in the future, where do you think we will see the unknown unknowns? I'm asking you here to look into the crystal ball. I guess it might almost an impossible answer, because these are unknown unknowns. But where should we put our efforts?
Yeah, this is obviously the big question at the moment. So obviously the tropics, and I mean, to keep it simple, what is it, 25 degrees north, 30 degrees north, 30 degrees south across. That's a lot of area. Areas where there's a lot of disturbance going on. In my view, live animal markets, industrial-sized live animal markets in urban sense, that's very silly. I mean, that we really need to just stop. There's really no reason for that. I think that's one thing we need to do. And the other thing, though, if I may just expand on that quickly, we need to really also come up with a system or a framework to decide on when is something going to potentially be dangerous and how we're going to evaluate that for policymakers. If we had in 2019, it would have been no surprise in our normal sampling going on in Southeast Asia if we had actually found SARS coronavirus 2. One of the bats we sampled or anything, we would have found it, sequenced it. We would have definitely sequenced it because we would have seen that it was quite close to SARS. Sequenced it, published it, probably wouldn't have been a great journal because just another coronavirus. And then we would have moved on, right? How on earth are we supposed to determine which ones are a problem? And that includes a whole stream of experimental work in a lab. Cell entry, does it interfere with interferon? Where are you going to end, and who's going to do this? And what's the time? How much time is needed every time you discover something? So this is going to be a challenge. And I think there's a lot of work going on at the moment reflecting on this. I think sort of early detection and increasing public health, access to public health across the globe is going to be key. That way they'll have early detection.
Well, yeah, I really agree. We just need to put emphasis on preventive measures as well, I guess. But again, I would like to thank you so much for a really, really interesting presentation. What time is it in your place now?
5 to 6 in the morning. It's a good time to get up.
Well, thank you so much for getting up early to give the presentation to us.
It's a real pleasure. Thank you.
And I think we will introduce our next speaker, which is Dr. Carlos das Neves. He's the Director for Research and Internationalization at the Norwegian Veterinary Institute, and was appointed by Norway to join a group of international experts at the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services. And here he worked on the relationship between biodiversity and pandemics, which is a topic that he will talk about now. So please, the screen is yours.
Thank you very much. Good morning and good morning to everyone. So first, thanks a lot to Caradee and Chris, because well, they've done pretty much the job. So I think we are all already, those that were not yet sold on that One Health is the solution, have got the message. So perhaps my job here today is to talk a little on, based of course on this report that Gaute has just mentioned, on how we've been trying to show links between the nature, pandemics, and what we can do. And we are not talking just about governments, we're talking about we, planet, all of us. So I'll try to go through some of these and perhaps now and then challenge us all out of our comfort zones. If I only had 1 minute to do this political pitch, 1 minute there with the Prime Minister to tell what this report was all about, we of course, and we've done this with some governments now, was to tell you then that what drives climate change and biodiversity loss is also behind pandemics. This is, if you have 10 seconds, this is what the report tells you. But with politicians, it helps to be a little more strong. So the message was sent forward quite dramatic, we will have more pandemics. And there's a very big likelihood they will get worse. They can get more nasty. They can cost more money if we don't really address the problem. You can't just make a report to highlight the problem and perhaps not provide some solutions. And this is what is done. Gaute just mentioned competence, kunskapsinteresse. And this is exactly the type, more than 600 publications that together with my 21 colleagues, we try to go through highlighting these links and some of the possible solutions. And again, on my 1 minute pitch, this has already been shown by Chris and by Caradee. I mean, the planet is very different from what it used to be, but some things haven't changed. Animals, humans, and microbes and pathogens have been interacting for thousands of years. And it's this interaction between here addressed by wild and livestock and humans that constantly is happening. And it will continue to happen. But we are making changes on these interactions. And some of the drivers here highlight are examples on how we are affecting these links and these interactions. And as you do that, you may open up for new challenges and new problems. Just a small message on why it's important to talk about One Health now. This is just to show you, I mean, in just 1 week after the report was launched, it had reached over 2,000 media inputs and more than 150 million people. Society needs to be a part of these processes, and society's interest. But interest fades away very quickly. This is just a quick show of how Google trends. So how people are Googling the word pandemic. And when we had the influenza, they looked for it little. When we had the H1N1, when we had MERS, there was a little peak, and there is no doubt that SARS corona is a game changer. But you see people Googling pandemic has reduced. Either we are all coronavirus experts, and that's likely because I usually say the only thing we have more than viruses is coronavirus experts these days, but the interest fades away very quickly in society. And sometimes the interest is also not correctly focused. I could challenge us all to think by showing this picture. This is the 2 pages of a British newspaper on the same day. And this is about telling, some of you follow up that we killed 17 million mink because they could be dangerous in Denmark for humans. And that is the little note here marked in this little box, tells that 17 million animals will be slaughtered because of a Danish mutation. 2 pages later, in a full page, the drama that a Danish goalkeeper might not be able to play because travel restrictions due to that mutation. Where are we putting our interest in this story? So we need to think about this. So the report goes through some links and some connections that we want to make sure to the audience that this is a fact. When we talk a lot about fake news, these are facts. Fact number 1, we need the biodiversity that surrounds us, and the way we're using these resources is harming this unique pool of resources. We are using them quicker than ever before, in many ways, not in the best, most sustainable way. This is happening at planetary level in many different fronts. That's fact number 1. Fact number 2 is that biodiversity is also going down. We are seeing a remarkable increase on the speed we are losing species throughout the planet. And while we are losing some species, we are also challenging others to living situations they are not used to, reduction in habitats, pressure from contact with humans, etc., etc. We are again changing this dynamic much quicker than ever before. And that's what some of these graphs These graphs are mostly for illustration. I won't go through the details on them, but I suppose these presentations will also be made available. Perhaps one of the biggest facts we take when we talk about these pandemics and biodiversity is land use. The way we use our land is behind a lot of infectious diseases, a lot of scientific work put into this, showing that land use is connected to a lot of emergencies of infectious disease. And it's easy to understand that. When you go into a forest and destroy a forest to make a crop, you might get in contact a lot more with animals that perhaps you shouldn't have so much contact with. So it's easy to understand that this has a huge impact. And sometimes it's not just that we are changing the land, but we are also changing, again, dynamics even between animals. I like this to highlight this publication here from Kenya. It shows a little on the graph that in the last 20 years, we have increased 70% the amount of sheep and goats, but lost, for example, 80% of the zebras and 80% of water bucks. We are changing in this specific ecosystem here in Kenya, the relation between animals. And when you do that, you change the relation between pathogens and you change the relation between those and us. These things are happening at an unprecedented speed. I could not, of course, avoid, and the report tried not to spend too much time on this because a lot of us are passionate. This is one of the main reasons behind a lot of the pandemics, is that we are in contact with this species probably in ways we should not. And wildlife trade, and we will have, I suppose, a little more on that today, whether it's legal or illegal, is behind a lot of the issues we are observing. Consuming these species and trading in them, like this figure here highlights, this is just an example of trafficking instances with zoonotic potential. This is how the problem spreads. If you're a Trump supporter and you want to call it a Chinese virus and that helps you to sleep in the night, be my guest. But it takes 8 hours and 50 minutes for that virus to reach Norway with a direct flight from Beijing. It will be the Norwegian virus in 8 hours. So this is the very good picture of globalization. And to illustrate this, there's been a lot of talk about the pangolins. If pangolins are behind corona expansion, or if they are the so-called middle reservoir we haven't heard about, we haven't learned that. But two things we know for sure. Number one, we are trafficking a lot of pangolins. This is just a graph showing how many we have managed to catch in this illegal traffic. So you can imagine how much we don't catch. And fact number two is that if this is part of your dinner diet, you really can't be surprised that you might catch something from a pangolin. I'm sorry, it's straightforward. So we need to think about this when we think about things that might increase the risk of pandemics. And perhaps last but not least, climate change. And climate change is linked in many ways to infectious diseases. And here I just choose to highlight 8 examples of diseases that, because they are vector connected, they are spreading perhaps to new areas where they didn't used to be. And some of these are no longer, well, the map is from Africa. I could say that chikungunya is an European problem. West Nile fever is now an European problem. Dengue has been as close to the Canary and Madeira Islands on the outer areas of the Union. These are not far away exotic problems for us who live here in Europe. So these are some of the drivers that we try to highlight in the reports. But of course, the interest is about pandemic viruses and the pathogen X. And Chris already showed something close to this slide that tells us that pandemics have been happening. They will continue to happen. But you see the dots. I mean, they are getting dramatically closer to each other. We are observing more and more of these as time has passed. And I'll get back a little to the costs as well a little later today, but there is no doubt that when these happen, they cost a lot of money. On top of loss of life, they cost a lot of money. So it's fair to ask ourselves, with this happening so much, are we doing a good job in when it comes to prevent and predict these things? Are we doing enough is a question. And let me challenge you by asking you to spend 10 seconds to read these 3 lines. I'll give you 10 seconds. These ones you should read through. I guess as you go through them, you will agree with me, this sounds exactly the type of measures we are implementing right now. This is something that Erna Solberg could have said, Emmanuel Macron, the WHO are asking us to do this. And that's true. But this was written by the Venetian City Council in 1348 to fight the Black Plague. And when you look at some old paintings from those days, and you look at the picture on the right just outside New York, the painting looks terribly the same. So the measures that they develop might still be actually effective, and they are, but have we come a little further in our knowledge, our technological skills to perhaps take prevention and prediction one step forward from 1348? Can we do it? The answer is yes. Corona is not the first big issue that we have addressed, but it has to do with the focus and the attention we paid and put into these relationships. And here I just chose Ebola, which Chris has also shown, a case where we know it's the contact with bushmeat, it's the contact between humans and consumption of these products that might get infected by bats that is behind some of these outbreaks. And let's be honest, like I sometimes say to myself, this is not a new problem. It's been happening since 1976. But it became a lot more popular once this picture started to populate TV. You know, once it was an African outbreak, it was one thing. Once it was live on national Norwegian TV, showing the first Ebola patients being transported into an hospital, I think for a lot of people, then it became a relevant pandemic. So this is also a reflection on how we, society, face these problems and where they are happening. But we do have solutions. And it's important to understand that they can be implemented everywhere. So this takes us to SARS. And I won't spend too much time on talking about SARS. That's not the goal of this talk today. But SARS has changed perhaps the picture on how we work, even in One Health. And I could illustrate that this is more or less the production of corona papers in the last 5 years, around 500-600 papers online on coronavirus. We just passed the 100,000 mark. So there is no doubt that when we put our hearts, our minds, and perhaps our dollars and our euros into this, a lot can be done. But let's keep on staying honest. Corona and this virus is not a novelty. And the reason it's not a novelty is that we have found a lot of viruses reported and listed in the international literature, exactly calling the attention, listen up, we are finding in these areas of the planet, these viruses, one of the 700,000 that Chris just mentioned, these can be a problem. I mean, some of our colleagues gone to the trouble, if you look at this map, this is a map of density of bats that can harbor dangerous coronaviruses. This is 3 years old. They didn't miss the bullseye, is not very far. That's Wuhan there. It's not very far from where it hit. So we are perhaps surprised on how quickly it spread. We might be surprised how perhaps little prepared we were, but let's not be surprised that we didn't know about it. So then, of course, the question is what to do, and what to do is act. And predict and prevent is the way to go forward. I think Chris said very clear, vaccines will sort out the problem this time, but what about next time? What about if the next vaccine is not as quickly done? 12 months to develop a vaccine is already a world of record, a record book holder. These things don't happen so quick. We were lucky. We might not be lucky the next time. So what are the measurements that can be put in place? And here, as we approach the end of what I wanted to discuss with you, I just give you the video that IPES has produced highlighting some of these measures. You won't listen to the sound, it's just music background, but you'll get to see a little of the ideas. Video shows that a lot can be done. And some people ask, it's a lot of measures, it costs a lot of money. It does. And I want to go through this paper from our colleague Andrew Dobson that has just been released, but it just gives you an idea that, yes, a lot of money can be that a lot of the measures in this report and a lot of the measures put forward by researchers may cost around $20 billion a year. We might have already passed the 16 trillion barrier. So even if we are wrong by 100 billion, it's still a lot cheaper. Even if we are wrong by 1,000 billion, it's still very cheap. So these are things that can be done. And I won't go today through the measures because it's a little outside the scope I want to tell you, but I will at least focus on the One Health. A lot of the measures highlighted in this report, again, take us back to the One Health, because protecting biodiversity is a One Health task. It's how we and nature interact. But a lot of these tasks don't depend on my government or your government. It depends as well as of us. Us, how we educate the next generations, how we make use of indigenous knowledge that have lived in close contact with this species. How do we change the way we use these resources, how we produce food, how we eat, how we travel? These are the changes that must be done now before it's too late. And One Health is without a doubt, as Chris has highlighted very well, the way forward. And here a slide very close to what Chris has shown. Here I just put the Sustainable Development Goals around, is that without understanding this dynamic and working in new mechanisms to make it work, we won't solve the problem. And then to finish, I leave a challenge. I suppose most of us in this seminar today are sitting in Norway. So One Health sounds good, and it should happen in Africa. The Swedes have organized their One Health. They have a structure, a national platform for One Health in the country. The Dutch have come that far. Maybe lacking a little bit behind, and we haven't come that far. And this is also, therefore, perhaps my last message to you, a call to arms that we should mobilize ourselves also within our borders a little more. And with that, I would invite you all, as a lot of us are preparing for the first One Health conference in Norway, which also will be the start of a platform that we want to be a little more stable way for us to work domestically in One Health. As Chris mentioned, the time for one more paper has passed. This is perhaps now, more than ever, the time to actually pull our sleeves up and do the work. And with that, I say thank you very much for your attention.
Well, thank you, Carlos, for a really, really interesting presentation. I'd like to remind the audience that you can ask questions as we go along, and I can forward those questions. We have a question when it comes to your idea of I'm not sure if it's your idea, but you mentioned that there might be, or there should be, an intergovernmental panel on pandemics. Is this something that's might happen? Is the talks about establishing such a panel?
Well, I think the Corona has opened, has clearly shown that there is space for new solutions. And when this suggestion was put on the table, it was not to try to compete with the work that WHO, because WHO, FAO, all these big organizations, their job is to fight these problems. And once we get rid of COVID, WHO has many other problems to handle. I mean, they're not lacking health problems in the human population. What we see, for example, with IPCC for the climate and IPBES is that a structure that allows some people to continuously focus on delivering knowledge has paid off. IPCC has become a big provider of the knowledge that governments need to act. So we see some movement. Will we have an interpanel government? We're not sure, but we see, for example, in Europe, we are establishing an agency for pandemic preparedness. So we see some movements here and there in this direction.
Well, that's reassuring.
Let's hope so.
Yeah, another question is, you mentioned that, or you showed a graph, and this is something that Chris Walzer also mentioned, that we see an increasing occurrence of zoonosis spreading. And is this happening because we are now in our city lives too distant from biodiversity and nature? Are we just too many human beings?
Well, I think here, I mean, it's important. I think it was very nice that Chris showed the difference between zoonosis and zoonotic origin. I sometimes remind my students the wildlife of the world is less than 3% of the biomass. It's a little hard to blame them for everything that happens, but it doesn't really matter if we are too many humans or not. But perhaps because we are now a lot more humans than ever before, we need to find new ways of interacting with these species, with these habitats, and with these nature resources we have. Because it is from this contact. Sometimes it's not a human with a pangolin or a bat. There might be a cow or a pig in the middle. So, and it might nothing to do with other than you travel to the wrong spot at the wrong time and you ate the wrong exotic foods. So these are the things we need to look into. So no, I don't think we will suggest a reduction in the human population, but we definitely all need to take a little better care of the planet.
Well, thank you again for a very interesting talk. I think we'll move on to the next speaker. This is Ivar Baste, and Ivar Baste is a senior advisor at the Norwegian Environment Agency and has worked on the coupling between climate and biological diversity. And he was on the steering committee in the International Science Policy Platform on Biodiversity and Ecosystem Services, and is now also leading the preparation of the Global Assessment Synthesis Report on a Sustainable Future. This is for the United Nations Environmental Programme. So, Ivar, we are really looking forward to hearing about your experiences on international cooperation efforts.
Thank you very much, Gaute. I hope that you can see me. Colleagues, pollution is really, as is shown on this picture here, is really estimated to kill millions of people prematurely every year. And this is due to risks from indoor and outdoor air pollution, water pollution, and toxic substances combined. Other environment-related risks, which kills millions or more people prematurely, actually. And estimates show that some 25% of all premature deaths can be attributed to environmental risks. So if you can die from an environmental degradation, then certainly that also means that environmental decline impairs the health of many more people. And risks associated with pollution is one thing. We've just heard from Chris and Carlos about the links between environmental degradation and the risks of pathogens. Later on in this webinar, we will look at the antimicrobial resistance. Another growing risk to human health is global warming and the impacts of extreme weather, for instance. We also know that nature is important for people's physical and mental health in so many ways. More than half of the world actually primarily rely on natural medicines for their health care. So the links between health and environment are multifaceted, as pointed out by you, Gaute, and by Caradee and Chris and Carlos. But human health is, of course, not only linked to the environment, it's affected by a number of social and economic factors also. Likewise, a healthy planet is not only important for human health, it's important for a number of other aspects of human well-being as well. So in order to understand the links between the environment and human well-being, we need international scientific cooperation. Just hold on the slide, please. I'll just keep it back to the original one. Thanks. So before going into a bit of the dynamics of the international scientific cooperation on environment, I'd like to take a step back and show you a figure which tries to demonstrate the links between environment and human well-being. It is actually inspired by the work of the Nobel laureate Amartya Sen. He won the Nobel Prize in Economy in '98, and he identified 4 constituents of human well-being. So if I could now have the next slide, that would be perfect. Thanks a lot. So if you see in the core of the circle, you can see that the 4 constituents of human well-being are good health, material needs, social relations, and security. And all 4 are interpreted really widely. So security, for instance, is security from war and violence, but it's also from food and water shortage. So clearly, good health is really important to human well-being. In the outer ring of the figure, there are factors determining human well-being. They include a range of economic, social, and environmental factors. And these factors determine the extent to which people individually and collectively can choose the well-being they want. It says Sen referred to them as the capabilities. So some of these factors are indicated in the sectors of the diagram. It's more like an illustration, but incidentally, it also reflects some of the key sectors in society, such as healthcare sector and the multiple environmental challenges that are being faced with. So if people are deprived of their factors determining well-being, then that leads to poverty and vulnerability. So if I could have the next slide, please. That then actually shows that today a large portion of the human population are poor and vulnerable. More than 1 billion people are poor, and more than 500 million people are hungry every day. So sustainable development is all about expanding the determining factors in a balanced way, and the balanced way forward is the mutually supportive and indivisible sustainable development goals. And the Secretary General of the United Nations, Antonio Guterres, he refers to them as the blueprint for human development. The achievement of the goals faces many obstacles, and obviously, as we've talked about already, a recent setback is the COVID-19 pandemic. But another one is what the Secretary General refers to as humanity's waging a war on nature. So if I may have the next slide, please. Actually, the Secretary General termed this a war in a speech that he last year gave at the University of Columbia in December. So I've put in a link to the speech in the slide. So if anyone wants to explore that speech, that's indeed possible. And Antonio Guterres, he said also, he termed it really a senseless and suicidal war. So I've sought to illustrate this situation with a cartoon made by the Kenyan artist Gado quite some years ago, actually, for the UN Environment Program. The situation that we're facing is driven by current expansive development patterns of humanity. We are facing basically a triple emergency, touched upon it already, and increasing temperature on Earth, mainly due to our dependence on increased use of fossil fuels, a use that has fueled economic growth, yes, nicely, but it's in many ways senseless because we depend on a stable climate. Secondly, we are losing species and degrading ecosystems. We displace other life forms, and if we do not do that, we eat them or we disturb their environment. It's also senseless because we depend on our interplay with life on Earth for food, water, and for so many other contributions. We're still polluting our environment and filling it up with waste. Marine life is choking with plastic. It's also senseless because we depend on a clean environment. Now, luckily, there is a lot we can do to address the situation, and it's filled with opportunities, but it is a tall order, and we really need to understand the relationship with nature. Luckily, environmental scientific cooperation is growing, and a lot of the cooperation happens in the international environmental science policy interface. And if I could have the next slide, please, I'll just make a few observations on the science policy interface. It's the basic foundation for it naturally is the international science, research, monitoring, modeling, scenarios, and on the other end, we have a number of environmental agreements, such as on climate, on biodiversity, on chemicals, and most of them we are not able to honor properly. We are actually failing to meet most of the targets. There's actually one which we are on course to honor, and that is the Montreal Protocol on the protection of the stratospheric ozone layer. And incidentally, the Montreal Protocol was actually one which was heavily reliant upon experts' assessments. It sort of paved the way in many ways for the international experts' assessments and assessments on the available science. And that is what Gaute and Carlos referred to as a knowledge synthesis, often in Norway. And this has actually taken on some very elaborate forms in the governmental scientific assessments. And as we've already talked about, one of the most prominent one is the Intergovernmental Panel on Climate Change. Another one up and coming, Carlos also referred to, is the one assessing nature, the so-called Intergovernmental Science Policy Interface on Biodiversity and Ecosystem Services, or shorthand IPES. And there's also another intergovernmental process, a flagship report of the UN Environment Programme called the Global Environmental Outlook, GEO. Now, these assessments follow very sort of iterative processes that often take several years. Representatives of governments and experts cooperate in the design and assessment of the scoping. They decide which questions need to be assessed, and then the experts assess the literature and bring a summary of the findings back to the attention of member states. And that last leg of the process is really important in order to conclude the dialogue between experts and policymakers. So this is an ongoing dialogue, repeated with new assessments, often on a regular basis. There could be special reports like the IPCC climate assessments on oceans and the cryosphere, on land, on the 1.5 degree, the IPES report on now recently on pandemics, although that was not an intergovernmental process. And one challenge really in the international science policy interface is that most of the expertise in developed are actually based in developed countries. So capacity building in developing countries is really important for the legitimacy and credibility of the assessments. There are also a lot of novel policy support tools being developed in the science policy interface. That includes, for instance, tools on valuation, which is really critical to evaluate nature. And the IPES is coming with a report on that next year, I think, on these tools. Other tools which are really key are on models and scenarios. I would like to draw sort of my talk a bit sort of to the close, also by drawing your attention to a new science policy interface product that Gaute mentioned, that I've been asked to lead together with Sir Bob Watson. And Sir Bob Watson is really one of the guys that have been key to developing the science policy interface in the world. He used to be the chair of the IPCC. He has also chaired the ozone assessment. He has chaired the IPES. If I could get the next slide, please. I'd like to sort of end with a few remarks on this new product that I've been asked to lead together with Watson, and it's really in response to the Secretary General's talk. And the report is actually titled "Making Peace with Nature," and it presents a scientific blueprint to how to tackle the climate, biodiversity and pollution emergencies of the world. The report is commissioned by the executive director of UNEP, and it has been produced by an eminent group of some 50 experts, authors and advisors from around 30 countries from all UN regions, and Caradee and Chris are members of the author team. The experts have been appointed by the executive director for their role in the current major global assessments, and the analysis involves really an assessment of the existing assessments and the findings therein. So we do not go back and assess the literature that the global assessments have already assessed, but we also sometimes add to that by assessing a new high impact literature that completes the picture. Now, this report is due to be published the 22nd February at the United Nations Environment Assembly. That's an assembly that this year actually will take place completely virtually. So I do not want to really go too much into the findings of the report, but I can say so much as it addresses actually the Secretary General's point that ending our war on nature does not mean that we need to surrender hard-won development gains, nor does it cancel the rightful aspiration of the poor nations and people to enjoy a better life. So this report basically shows how the well-known findings of existing assessments combine to an interlinked and unparalleled planetary emergency. It is also recommending how the accumulated base of scientific evidence can be turned into high-level actions. And it concludes basically by pointing to that everyone has a role to play in ensuring that human knowledge, ingenuity, technology and cooperation are redeployed from transforming nature to transforming humankind's relationship with nature. And with that, I thank you, and I apologize for somehow the camera failing me in the just the critical moment. It worked all until I was just about to go on the air. Thank you.
Well, thank you, Ivar. Very nice presentation. Even though we couldn't see your face, we were still able to see your slides and hear your voice clearly. I think we will take time for one question, and I wonder, those international efforts such as the IPBES and the Global Assessment Synthesis Report sort of makes me believe in what I do as a scientist is the help and good for society. But sometimes I still have a feeling that the information I produce there's a too long distance from the information I produce and into usefulness for society. So my question is, I guess, is the distance too large between us researchers and policymakers in terms of the information we actually produce?
Yes, I think you're right. Sometimes the distance is large. Of course, in a way, what we're talking about is an interface between science and policy, and that interface sometimes is actually also very short. I mean, if a head of state talks with an eminent professor at a university, it can be extremely short. I mean, you can really be informed instantly almost, and sometimes that happens. But when we're talking about complex issues where society need to change the course of action, such as the transition to a green society, the transformation of society, then of course decision makers need to be very sure that they base their actions on solid science. And that is, I think, where these intergovernmental scientific assessments come in very handy, because you can actually deal with very complex issues and still facilitate the interaction between those who are experts in their different fields, so they work together, and you can have the dialogue between experts and the decision makers all sort of built into one process. And I'm quite optimistic. I think those processes are really key to ensuring that we manage to transform society and move towards a sustainable future.
Well, thank you. That's reassuring.